Hello, good morning, good evening, everybody. I am Vaidya Manvikar. I am talking from Minnesota. I would like to welcome you all to Global Council for Ayurveda Research's GCAR Global Webinar Research Series. GCAR Global Council for Ayurveda Research is an international non-profit organization based out of USA. Our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. No nonprofit can operate and succeed without volunteers. So consider joining us as a volunteer and we can place you in a variety of projects based on your skills and your interest. Once again, our website is www.ayurvedaresearchusa.org. Now, I would like to introduce our eminent speaker today, Dr. Ashwin Sawant. He is BAMS from Shet RV Ayurvedic College, Sion, Mumbai. He is MA in Sanskrit from Mumbai University, MBA in Healthcare Services from SMU, PhD from Mumbai University with his subject on hygiene in ancient India. Very interesting. He has written more than 3,000 health articles published in various newspapers, magazines, journals, and calendars. He is the only Ayurvedic doctor who has done research presentation in the Indian Science Congress organized in Mumbai University in Jan 2015. His subject was Advances in Surgery in Ancient India. He has done 7 radio programs, 25 live TV programs, and participated in discussion on various health topics. He has been awarded by well-known Sandu Ayurvedic Company for his contribution in the field of Ayurveda. His 9 research papers are published so far in various journals. He is an accomplished author. His book is published on diabetes in Marathi with the name Madhumeha Viruddha Apan. It is published and the foreword is written by Honorable Dr. Sanjay Oak, sir. He is well appreciated, and now this book is going to get translated into English, Gujarati, and Hindi, various languages. There are a couple of forthcoming books, Rutu Samhita, which is about Dinacharya, Rutucharya, and also there is another book which is in Marathi, Apan Zad Ka Hotoy. The reasons regarding obesity, which is a huge pandemic currently. He has keen interest in studying basic Ayurvedic concepts. He is passionate about ancient Indian sciences. Practicing in Mulund, he has his own clinic called as Shashwat Ayurvedic Clinic. He has got recognition as an authentic Ayurvedic physician with clinical experience of more than 30 years. Now, let me welcome you. This all floor is yours.
Thank you, Dr. Savari.
Thank you.
My salutation to Lord Dhanvantari, to all my teachers, my parents, Dr. Rajan Patankar, who has recommended my name, Dr. Asavari, who is the organizer, and thank you for giving me this opportunity, and also to the Global Research Ayurveda, all honorable members, and the audience, whoever is listening to this lecture. Today's subject is surgery in ancient India. So when you speak about surgery in ancient India or surgery in Ayurveda, definitely eyebrows raise and people have doubts, not only abroad but also in India, whether actually there is surgery in India or in Ayurveda or what. Because people have this perception that when you say Ayurveda, it is only related with Tulsi and Ashwagandha and Musli and aloe vera and all turmeric and all other herbs. What Ayurveda has got to do with surgery? So you may be surprised to know that there was a surgery, not just surgery, but advanced surgery in ancient India, which was definitely a part or branch of Ayurveda. So let us start. First, we will see some references from ancient Indian literature, not only Ayurvedic or medical books, but all the way from Rigveda to Atharvaveda, we find references in various Indian literature which indicate surgery or surgical practices. You can see this first reference is from Rigveda, which says that the wife of King Kela was injured. Her leg was injured and it was replaced by the metallic limb, and she was made capable of walking. Rishi Pararuk was given vision. We find references in Kaushik Sutra about weapon injury and treatment given for bleeding and the fracture. Human body parts, various human body parts are mentioned in detail in Atharvaveda. In Jaimaniya Brahman, we find reference of young boy's body which was damaged and injured under the horse cart and which was treated very well. These are the references about Madhu Vidya, that is organ transplantation, and Pravargya Vidya, that is plastic surgery. And these two branches of surgery, they are mentioned not only in Rigveda, but in Brihat Aranyak Upanishad and also in Shatapatha Brahman. Again, in Rigveda, it is written that blind Kanva was given vision. Removal of fetus by puncturing uterus, that is what we call in modern day cesarean section. It is mentioned in Atharvaveda. This is references from Mahavagga, which is a text which is related with Buddha religion, where we find the reference of cranial surgery. In Malavikagni Mitra, which is a famous Sanskrit text, there is a reference of cure of snake bite. In the same text, we also find the reference of expert of toxicology. In Manusmruti, we find that a rice which is cooked by a surgeon should not be eaten by a common man, which definitely gives us some reference about surgeons and some prohibition, which was a social prohibition in those days. Now, when you see this and some other references which we are going to see further, a question arises in our mind that these references are indicating mythology, or they are related with mythology, or it's a scientific fact, and whether there was actual branch of surgery in ancient India. So let us see. You can see here in almost all texts of Ayurveda, it is mentioned that there were 8 branches of Ayurveda. That is Kaya, Bala, Graha, Urdhvanga, Shalya, Danshna, Jara, Brushan. What are the meanings of those 8 branches? It is clearly mentioned, and we can see that this is how even modern medical science is divided in various branches. In the same manner, it was divided 5,000 years back, and one among them was Shalya Tantra, that is surgery. There were 2 schools of medical science which were famous in ancient India, and one was of medicine and one was of surgery. The one which was related with medicine was called Atreya Sampradaya, or a school of Atreya, or another which was related with surgery is known as Dhanvantar Sampradaya, which was definitely a school of surgery. Here we tradition was going on for ages. There used to be a teacher who used to teach various pupils, and among the pupils, whoever used to be the most wise, most intelligent, most knowledgeable used to become a further or next teacher. And the same manner, this tradition of which is called Gurukul or Guru Shishya Parampara was going on in India for thousands of years. Unfortunately, during British dynasty, during British Empire, this whole system, the ideal system of education, was completely ruined by the Britishers. But here we can see that there were two schools, one related with medicine and one with surgery. Now here we come to the text which was compiled or was created only which was related to surgery, and that is known as Sushruta Samhita. Here we can see how it was created. Sushruta Samhita was narrated by King Deodas, who is known as the Dhanvantari, who was a teacher, and it was written by the Sushruta. And since Sushruta wrote it, Sushruta created it, it was known as Sushruta Samhita. In front of you, there are various steps which are giving you idea how year after year, generation after generation, this compilation or creation of Sushruta Samhita was going on in India for around 2000 years. Just go through it. Now you can see that there is one text which is famous in medicine, modern medicine, which is called Harrison System of Medicine, which is going on for around 2 centuries. The creation is going on for around 2 centuries, which is considered as one of the ideal text of modern medicine. But here you can see that Sushruta Samhita was created, or it was narrated by Dhanvantari. It was created by Sushruta, who was a senior Sushruta. The timeline was beyond 1500 BC. Again, in 2nd century AD, it was edited by junior Sushruta. And again, re-edited by Nagarjuna 5th century, and so on. So the last commentary written on Sushruta Samhita was in 12th century AD, which is by Dallad. Here I would like to stress on one point, which is the reason, that is the reason why modern historians or modern scientists have been considering that Sushruta Samhita was created in 2nd century AD. The Sushruta which was present in 2nd century AD is actually a junior Sushruta. This was the name, this was a tradition. That these were the two different people. One person who was a student of Dhanvantari, who existed in during 1500 BC, or that period can go beyond that. Modern historians did not know it. Either they did not know it or they knew it, but they purposefully brought this period to 2nd century AD, considering that Sushruta Samhita is not that old text. But actually you can see now various references are proving that Sushruta existed during the period of Rigveda. The references of either Devodas, who was a teacher of Sushruta, and the Sushrut himself, their references are found in all this ancient Indian text. Now, if you see Panini Ashtadhyayi, which is a ideal text of Indian grammar system, the period of that timeline of that Panini Ashtadhyayi is around 2400 BC. And Panini Ashtadhyayi has mentioned Sushruta. That means Sushruta was there before Panini. So these are some actual evidences which prove that Sushruta existed long back. Now, if you see the modern historians, among them Rudolf Honle, who wrote the Osteology of Hindus, or the medicine which is related with bones, that text, which was written in 1908, in Hanle has proved Sushruta's period as 600 BC. Priyavat Sharmaji, in his book of Scientific History of Ayurveda, was a great scholar of Ayurveda. He has proved it to be between 1500 to 1000 BC. And Nilesh O, who is a modern historian with all modern references like geology and archaeology, computer science, and with all modern technological and archaeological references, he has proved that Sushruta's period is earlier than 5561 BC. I have given you references over there, so whoever is interested can go and dig it more. Now let us go to the text. Are you able to see the screen completely, Dr. Asavari?
Yes. Yes.
Can.
Clear and visible.
Yeah. So here you can see Shushruta Samhita is the first text to elaborate importance of accurate knowledge of anatomy before becoming a surgeon. So you need to have a proper knowledge of anatomy. Without that, you cannot become a surgeon. He was the first to demonstrate method of human body dissection. Consider this period as 1500 BC, and you should know just 400 years back, modern science has started doing actual dissection of human bodies. So we can imagine how advanced Indians were in doing actual study on human body. To stress importance of both theoretical and practical knowledge to become an expert surgeon and to define qualities of a surgeon. Shushruta Samhita is the first text to describe the selection criteria and ethics of students of surgery. There were certain points, certain factors which were considered important while selecting a student who is going to become a surgeon. So it is just like modern days, but when we consider only written exam, a success in written exam to become a surgeon, there were definite criteria which were defined by Shushruta Samhita, and based on that, a student was selected. Again, Shushruta Samhita is the first text to claim requirement of governing authorities' permission before starting surgical practice. This is what is even we are following today. You have to get license or permit from the governing authority, then and then only you can do the surgical practice. To understand responsibility and duties of surgeons before entering into profession, and to describe surgical ethics. Everywhere I have given reference, so whoever is interested can go through it. That SS indicates Shushruta Samhita. First number is the volume, second is a chapter, and third is the verse or shlok. Now, here I am showing you the reference from Mahabharata. In the Bhishma Parva, when Bhishma was lying on the bed of the arrows, it is said that Duryodhana, after the request given by Arjuna and Krishna, Duryodhana invited the team of surgeons, and team of well-equipped surgeons approached Bhishma to treat him. Here's the reference from Mahabharata itself, which is India's one of the ancient Indian texts. In Ramayana too, we find reference of weapons, manufacturer and sellers. Either they were manufacturers or they were sellers, which is among the list of various types of workers, various types of jobs or business or services which were there in that time society. And that word is Shastropajivina. What does it mean? Those people who live by either manufacturing or selling weapons or surgical instruments. The reference is there in front of you. So, question arises in our mind when we see such references that well-equipped surgeons approach Bhishma, and there is a separate reference of Shastropajivina, people who used to live by either manufacturing or selling the surgical instruments or weapons. Does it mean there were actual such people, and do we have such references in Sushruta Samhita? So let us see what Sushruta says. Who is expert surgeon? Only he can be considered as an expert surgeon who is well versed in the practical and descriptive anatomy. Hence, one should start the surgical procedures only after clearing his doubts by actually watching and by guidance. So, theoretical and practical knowledge importance is mentioned here. Here, I'm also showing you this text, which was initially the name was Osteology of Hindus. His present name is Studies in the Medicine of Ancient India. This was written by Hanley, and the timeline is 1907. We should understand this fact was very well accepted by some Western scientists, Western historians. These are the properties of surgeon. Once you become a surgeon, what properties should you possess? You can go through them. There are 20 types of sharp instruments which are described in Shushruta Samhita. 101 types of blunt instruments. Sharp instruments are called shastra, and blunt instruments are called yantra. They were made from the special steel. Qualities and defects of each instruments are described in wide description. How you should hold it, how you should use it, what is the precise use, and in which condition, in which disease, which instrument should be used is very well explained. Even a surgical case is described. And you can see that unfortunately this practice of surgery, since it was banned in India for around 1000 years after the era of Buddhism and Jainism, and even in the Muslim dynasty, and even in British during British Empire's control over India, this was not practiced, and unfortunately it went to the people like potters, and unfortunately it was not practiced, or it was not trained, or it was not taught in the colleges. But we can say that residue, that practice was there somewhere in some people, they were following it. And you can see that still this type of surgical case, which is made from the leather, is still used in villages by some barbers. And that description at the bag which they used, the leather bag which they used to keep their instruments, is just as it is described in Swiss Center. These are the photos of 20 surgical instruments. These are shastra. We can see that the names are here. We are going to go in detail in future further slides. What are the defects of sharp instruments? It should not be easily bending. It should not be blunting, breaking by pressure, jagging, too thick, too thin, too long, too short. You can see that every aspect of surgery or surgical instrument is very well explained by Shishra. How should be the age of sharp instrument? And see, first is here some surgical procedures are mentioned in first column: incision, scarification, puncturing and evacuation, and dividing. Sanskrit names are also given, and which type of instrument should be used for this particular surgical procedure, and what should be the age size of that instrument. I would like to consider you where you can see that Vruddhi Patra used to have an age of which was half of human hair. Can you imagine that? The age of half of human hair. This was the surgical instrument which was produced in India 5000 years back. Here we can see reference of transplantation, which is from Ayurveda, and one is from Rama and Balakanda. Attachment of lamb scrotum. Now see, in today's day, now this, if I would have talked about this 25-30 years back, nobody would have believed this. But now it is possible. Now we can see that it is happening. Transplantation is already taking place all over the world. So at least now we are ready to believe that such things can happen. Now, if the references are found in some other text other than medical or other than Ayurvedic text, do we have such references in actual Ayurvedic text? Yes, we have. Plastic surgery references are there of rhinoplasty, of autoplasty, and also of the cleft tip of cut lips. You can see that there were 15 methods of autoplasty. That is how to stitch a punctured ear or cut ear in 15 types of methods where are described in Suchar Science. Now, these are the 15 methods of autoplasty or Karna Sandhana Vidhi. Here we find references of cranial surgery or skull surgery in some ancient Indian texts. One is from Mahavagga, where Jivaka performed surgery. One is from Bhoja Prabandha, where cranial surgery was performed on the King Bhoja himself. And we also find reference of cranial surgery in Shishrut Sanghita. Now, do we have some references or evidences which can prove this? Let us see this. This skull, which was found in Kashmir, and the timeline is approximately 4,000 to 4,500 years back. Now, this method is called trepanation, and initially it was considered that this type of method, that drilling the skull by using some devices, some instruments, this was followed only in the country called Peru and also in Chile. And this has got something to do, this is related only with the Inca civilization. And they thought that this is restricted only to Inca civilization. But fortunately, some skulls are discovered in archaeological excavations in Kashmir. And you can see that there's a reference. You can go through that. You can read in detail about that. This trepanation was going on in India. Now, some people say it was for religious purposes. But even if it was for religious purposes, we can see that some device was developed by those people which could pierce through the skull. It is not easy to pierce the skull. Now, whether it was done on live human bodies or on dead bodies, that is not clear. But when we see these old references, this clearly states that such cranial surgeries were performed in India during that period. This is the reference from Rigveda, where it is said that bleeding from the neck was arrested, was stopped without bandaging it. What does it mean? That bandage was not, it was stopped by some other measure. Are there such references in Shishru Samhita? Yes, do we have? We have Sandhana, Skandana, Pachana, Dahana, Bandhana. I have also given you English meaning, which are the 5 types of methods to stop the bleeding. Because during surgery, definitely bleeding will take place, and if surgeon is not capable of stopping the bleeding, he will not be successful in healing that wound or completing that surgery. So these are the methods, and we can see that ligaturing, which is considered even in modern surgery as the last method to stop the bleeding. When you don't have any other option, you have to actually ligature it, and use of sheep's gut was done in India. The reference is from Ashtanga Sangra. This text was created in 6th century AD. So for India, it may not be very old, but still we find actual reference in Ashtanga Sangra where bleeding can be stopped by ligaturing with the help of sheep's gut. This again is a reference of Madhuvidya, that is organ transplantation from Rigveda. Please go through it. Again, this is from Rigveda and one is from Atharvaveda. It is said that injured boy's damaged body was repaired by Sandhana treatment. Now this Sandhan is joining, that is nothing but plastic surgery or reconstructive surgery. Now, do we find such references? Now, this is that famous picture of Kavarji. Now, he was a bullock car driver and he was injured in the war which was going on in between Marathas and Tipu Sultan. And this happened in 1794. And when his nose was cut by Tipu's soldiers, he was brought in Pune. And in Pune, this surgery took place, which was observed by 2 British officers, Findlay and one name is there. And these 2 British officers, when they observed it, this surgery was performed by a potter. And it was such a successful surgery that they mentioned, they wrote about it in England's Gentleman's Magazine. Now, for India, this may be a recent thing. In 17th century, for India's history is not a very old thing. It is just a recent thing for India, 200 years back. But I would like to give you step-by-step timeline about this plastic surgery of cut nose, which is famous as a rhinoplasty, and we can see how it was going on. This is the method which is described step-by-step in Sushruta Samhita. So definitely the actual method is mentioned in a descriptive manner in Sushruta Samhita. That we have to accept that it is absolutely proved. Now let us go further. This is an English explanation. Let me tell you what was done. When a nose was cut, actually when nose was cut, what they were doing, that they used to remove the flap from the above skin which is from forehead. Now in Shushruta Samhita it is mentioned that it should be removed from the chicks. And what some surgeons in modern days they say that what Shushruta has said is rather more correct, because there is a fold just below the cheek. So if you remove the skin from the cheek, that fold will hide that wound, and then it won't be very easily visible. Whereas in this case, the skin was removed from the forehead, and it used to bring it down. They didn't cut it; that the end was kept like that, and then it was stuck on that nose. And two small, you can see here, you have to lift the skin and give it the shape of a nose, and two small bamboo tubes were inserted inside to create the openings for the as if they are nostrils, and sprinkle some medicated powders and apply cotton dipped in medicated oil, and it was kept there, and within some weeks that nose we used to get formed as if it's a natural nose. And this is the method of reconstructive surgery of nose. Now see the timeline of this. I would like to tell you something about this surgery which was going on in Italy, which is called as the Tagliacozzi, and this method was very famous, and he was given a credit as if he was a pioneer of plastic surgery. But let me tell you, somehow this method in India was that news somehow went to European countries. How it went, I'm going to show you further. But it was misinterpreted or misinformed or misunderstood. And what they used to do, they used to take the skin from the arm, and that nose was actually kept bound or stitched to the arm for some weeks, and that patient has to be in that position for some weeks till that nose gets healed. So we can see that definitely this method was not correct. Somehow they were either misinformed, or they that news what we say that actual news was right, but while reaching to Italy it was misinterpreted, and how it was misunderstood, it is actually there in front of us. And we can see that real method is this. And you can judge by this that we do not find any written reference or evidence of this method in any modern medical text. But whereas further, this Tagliacozzi, here I'm going to show you the step-by-step methods, timeline of this particular rhinoplasty. See, 1500 BC is Sushruta's period where this method is described very well. Again in by Vagbhata, that is Ashtanga Sangra, which was written in Kashmir in 6th century AD. It is again mentioned, again it is described. So it was going on in India for all these years. Now this Branca family in Sicily, in Venice, in Italy, this only one family knew this method. Now how is it possible that if the whole community, the whole country doesn't know about it, and one particular family knows about it? So that is because they somehow knew about it. How it happened, you can see that one professor approached this family further, and he tried to understand how do they do it. Branca family never informed anybody else that how this rhinoplasty is done. Further, in 1597, Tagliacozzi learned it from Aranzio, and then he published it in his text, which is called what, De Cultorum Chirurgica per Insaniam. I can't pronounce it because it's I think this is the Latin language. And then in Germany it was translated, which is again 1598. All through the year we can see Manucci, who is very famous, in his text called Storia do Mogor, which he wrote when he was in India, and he wrote about the Muslim dynasty, Mughal dynasty, and he has written, described the complete procedure of rhinoplasty, which used to be done regularly in India. That period is 1653. Okay, you can see that. Then further in Venice, again it was there. British surgeons Thomas Crusoe and James Findlay, as I said, they saw this method, which was done in Pune by a potter, and they wrote in Gentleman's Magazine. If it was again neglected for some years, And then Joseph Constantine, who visited India and learned in India, he described in 1816, and so far again it was ignored. So in 1890, Tribhuvan Das, who was a chief medical officer of Junagadh, he performed rhinoplasty and wrote a book. And then slowly, gradually, this news, this event, or this method was understood by Europeans, and they followed it. So actual credit of rhinoplasty definitely goes to Sushruta, who was an ancient Indian surgeon. We can see here, Arabic medicine was founded on translations of Sanskrit treatise, that is Ayurveda's Shushruta Samhita, and then in turn, it was translated into Latin language. Through Latin, Greeks learned it, and then from Greeks, whole Europe learned surgery or rhinoplasty. And this is not mentioned by an Indian scientist, but this is a great historian, Gordon Davis, who has mentioned it in medicine throughout antiquity. Here I'm showing you the sculptures from one temple. There are two temples, one is in Tamil Nadu and one is in Kerala, where fetal development is shown on the roof of the one temple. And you can see that surprisingly, the positions and overall that umbilical cord and everything is so perfect that we get surprised as if they had some device by which like a sonography, ultrasonography, through which they could actually see what is happening inside the uterus. We can't imagine. And that period is also too ancient. This is at least 1000 years old temple. Now, do we find something about labor room or such gynecological treatment in Shushruta Samhita? Yes, of course, it is there. Maternity home and labor room is explained. What are the signs of labor? They are described. Management of the first stage of labor, management of the second stage of labor, manipulation of abnormal presentation, how you should do if at all, if by chance fetus is in an abnormal present situation, and how you should manipulate it. There are some texts. Now, actually, the words are very minimal, but as I said, this was a tradition of what is called Guru Shishya Parampara. From teacher to pupil, this was going on for thousands of years in India. So every time a teacher used to teach a pupil that how you should manipulate when a birth is not happening naturally. And this is what is mentioned in Sri Samhita. Postnatal care is also mentioned, and rituals of the newborn. These are the methods which are described in various chapters in Sri Samhita. I brought them together and which will give you actual idea of labor room and act labor. Here are the evidences which fortunately we have found in one temple which is from 12th century AD. That is Airavateshwar temple from Tamil Nadu. Here you can see that one lady is preparing the medicines here. She is observing them. Second one is thinking how it is to be done, what should be done. And these two ladies are manipulating and helping this birth giving mother. Let me show you something. There is a net here. I think you can see that. This is a net. So when a baby comes out, that baby should not fall on the fall down, and it should get trapped in this net. These are the two methods again. Basis in a sleeping posture or maybe in a standing posture, and mother is giving birth. And here you can see childbirth in a standing posture, which is assisted by nurses. And as I said, there's manipulation going on. This is one more nurse who is going to assist her. A baby is coming out, and there used to be a net, and she used to help in the delivery. Now you can see in this all these sculptures. First one, this second one, this third one. This is again from the 8th century AD. You can find the references also. In India, deliveries were done in a standing postures. Ever since modern science has introduced this method of evacuation of baby in a sleeping posture, I think cesarean has increased. Now, let me ask you one simple question. Can you pass your stool when you are in a sleeping position? You cannot. You have to be in a either sitting posture, right? Or maximum, or you may be able to do it in a standing posture, but never it is possible in a sleeping posture. In the same manner, evacuation of the baby or normal delivery of the baby is possible only in a standing posture. Here we find this method which seems to be ideal, and I think this is what we can learn from ancient Indian texts, that deliveries should be done in a standing posture. We may have to give a better thought, we may have to modify it, and we may have to assess it by some modern techniques, but I think this could be a one boon from ancient Indian text to modern community. Here you'll be surprised that cesarean, what we call cesarean, what is that is cutting the or dissecting, or I mean take a incision on the abdomen, on the stomach, and then cut the puncture the uterus and take out the baby. This method, which is called cesarean, is in Ayurveda, it is called Udara Patana. That is, taking incision on the Udar, that is stomach, is mentioned in Rigveda, which is 5 to 6,000 years old text, and it is also mentioned in Atharva. It definitely means that this method, this surgery was going on in India since thousands of years. This sculpture is found in Kaushambi, and that museum it is kept there. You can see that how it was done. And here we see the ancient reference of induced abortion. This will again be a surprise for you. That reference of induced abortion is found in Rigveda, clear enough to state medical advancement in those ancient days. Again, it is also mentioned in Sushruta Samhita. Now, what should be done? You should not directly jump for the induced abortion or even for the cesarean. If at all, what is the method? How does Sushruta describes it? First, prognostic consideration was done. Attempts were made to do the normal delivery. Obstetric manipulation sculptures we have seen just now were done. And then when all these methods were felt, then and then only decision of termination of pregnancy was taken. And that was done by the extraction of fetus. Which instrument to be used? Vruddhi Patra, that is scalpel. It may hurt the mother during the operation. Hence, it is mentioned that this should not be used. This gives a clear idea that how perfect, how precise Indians were there in doing this particular surgery. A physician who is well versed in anatomy should use a mandalagra, that is embryo knife, for the purpose of cutting out the fetus. Now let us see. This is the exact method I am explaining here. This was the instrument which was further known as embryo knife or decapitator, which in Indian text it is called Mandalagra Shastra. This was found in Takshila, in excavation near Mohenjo-daro and Takshashila and all other lands. And here I am showing you the modern version of this embryo knife, which was used till 1950. Now let us see what Sushruta Samhita says about Mandalagra Shastra or embryo knife. It should be used in enlarged tonsils. It should be used to pierce the skull of a dead fetus in utero. This is actually what is described in Sushruta Samhita. In operation of pterygium, that is a particular growth on the eye, this is what's considered useful to scrap away the root of any new growth in the eye, which is mentioned in Chakradatta, which is comparatively a recent text, and for scarifying the tongue for bleeding in the disease called Jivva Kanta. So, by understanding this, we come to know that this was an instrument, surgical instrument, which was very well used in India since thousands of years, and the precise use and precise indications are very well explained. Now you can see this is how this surgical instrument to traveled from India to other countries. Now we can see that it was found in the oldest site of Bir Mount, that is in Takshashila. That timeline by historians is proved to be 300 to 200 BC. Alexander visited India to Takshila at the same time, 326 BC. What does it mean? Alexander took some Ayurvedic doctors or some Indian surgeons and physicians along with him to Greece to understand Ayurveda, to understand surgery, to learn surgery. And this is the way how Indian surgery went to Greece. Further, we can see embryotomy and use of hooks was recommended by Soranus officers. That period is 1998 to 138 AD. Recommended embryotomy by ATS of Amida. And you can see step by step this was going on for hundreds of years. But initial credit of use of embryo knife on Mandalagra Shastra definitely goes to Shushru Samhita, that is Indian text of surgery. Do we find some pediatric references in Shushru Samhita and or in other Indian texts? Special room for child care is mentioned in Charak Samhita. Pediatric expert physicians are mentioned in Raghuvamsha, which is written by Kalidas, and even in Arthashastra, which is a great text written by Kautilya or Chanakya. Physicians to care during pregnancy and delivery of mother, and who can also take care of a child or baby after delivery. These are the references from some other texts other than Ayurvedic texts. Here we can see one sculpture which tells you about the pediatric care which used to be done in India. Here I'm going to show you one surprising thing, how Shushru Samhita has described the human cadaver dissection. People may be surprised the step-by-step method is mentioned in Shushru Samhita, because if you want to become a surgeon, you need to have a precise knowledge of anatomy of human body, and that is why human cadaver dissection was done regularly in ancient India. Shushru Samhita describes fetal development, has described bones, classification of muscles, ligaments, tendons, joints, classification of joints, veins, arteries, heart as a center of circulation, and various soft organs too. Here, I'm going to show you one reference from Rigveda, where it is mentioned that Shava, whose body was cut into 3 pieces, was given life by Ashwini Kumars, who are considered to be doctors or physicians and surgeons of ancient time. Now, when you say that body was cut, it means that it was definitely stitched. To stitch, you need to have needles. To stitch, you need to have threads. Which devices or which instruments were used in ancient India? Here I'm showing you. Unfortunately, these pictures cannot be seen here. There were straight needles, there were semi-curved needles, there are straight needle of 2 fingers long, and there are curved needles. So straight needles which were short, straight needles which were long, semi-curved needles, and curved needles. These are the 4 types of needles which are mentioned in Shushru Samhita. Incision should be taken. Normal incision should be taken, which is on normal body parts in the skin, which should be in a direction of hair. Oblique incision on these particular parts, circular incision on upper and lower parts, and semicircular incision should be taken around the penis or around the anus, near the anus, with a proper application. Now, this illustrates us how Shushru Samhita described every part related with surgery. Which material was used as the sutures? We can see that horsehair or tendons were used, thread made from the flanks were used, or fine threads made from the bark of Ashwantha, which is a particular plant, and or fibers made from the plant Murva or Guduchi were used. Here in second column, you can see there are 4 types of methods of suturing are mentioned. Here you can see the pictures of those methods and which are still used in modern surgery. Now, if you compare all these instruments, ages of the instruments, types of incision, which incision should be taken in which body part, what types of material was used for suturing, methods of suturing. This type of description we do not find in any text of that ancient time. This clearly states that antiquity of Indian surgery. How the surgical instruments were made sharp, and what was the method. The particular liquids were used to make those weapons sharp. These are 8 types of surgical procedures. The whole surgery, the complete surgery, can be described, can be uh, uh, classified in these 8 methods of surgery: excision, incision, scraping, puncturing, probing, extraction, drainage, and suture. So while doing surgery, you use any type of method which is described by Shushruta. These are 101 types of yantra or blunt instruments. These are the defects of blunt instruments. Types of blunt instruments. There are cruciform instruments or swastik yantra, which are modern forceps, dissecting forceps-like instruments, which are called sandansha yantra, tala yantra or spoon-shaped instruments, nadi yantra, tubular instruments, shalaka or probes, and accessory instruments. Now we are going to see step by step actual pictures of ancient instruments, ancient Indian surgical instruments, and how they got converted into modern surgical instruments. Here I'm showing you surgical instruments which were found in excavation and Takshashila, which was Mohenjo-daro period. This land is presently in Pakistan, but that was a part of ancient India. And tongue depressor, probes, ointment applicators, decapitator, or embryo knife, various probes to apply ointments or oil, and spatulae. These are the instruments which were found in excavation in Mohenjo-daro and Takshashila. Let me tell you, for almost 100 years, these were considered as the minor objects found in excavation in Mohenjo-daro Takshashila. But in last 20-30 years, scientists have understood that they were not minor objects, but these are the surgical instruments which were used in ancient India for various surgical practices. Mandalagra Shastra, which is found in Takshashila, this is the description or study done by the J. Marshall, who says that this was made from the solid copper, and timeline approximately goes to 1st century AD. These are the yantra or surgical instruments which were used in ancient India, having the resemblance of the mouths of the animals. And these are the Sanskrit names, and animal mouth shape, these are the English names. These are bird mouth shaped forceps. Various names are there, and these are the English names. Now let us see how they got converted. Sihamukh yantra become tiger jaw forceps. Vyagramukh forceps is there in front of you. Wolf forceps or Vrukamukh forceps, which become a wolf tooth extractor. Even there is a resemblance in the shape in ancient surgical instrument and modern surgical instrument. Here you can see kite forceps, which became lower dental forceps. Grudramukha forceps, falcon forceps, which is same like modern molar forceps. Makarmukh yantra, that is crocodile forceps. It's still in use in modern surgery, which is known as modern crocodile forceps. This is ancient throat speculum. This is a modern laryngopharyngoscope. This is ancient rectal speculum mentioned in Sushruta Samhita as Arsha yantra. This is modern Ferguson's rectal speculum. This is ancient urethral syringe or Basti yantra, which became urethral syringe in modern science. This is ancient midwifery forceps, Yugma Shanku, mentioned in Sushruta Samhita. This is modern midwifery forceps. This is Garbha Shanku or fetal traction hook, and this is the fetus traction hook in modern science, which were used in last century. In modern days or in last 30 to 40, 50 years, now this have been converted into modern advanced surgical instrument, Now they are no more in use. But in last century, or I should say the first half of the last century, this surgical instrument were used by even in modern surgery, which were actually derived from the ancient Indian surgery. Suction cannula or Dakodar yantra mentioned in Sushruta Samhita, which is a modern uh, instrument which is used to remove the water from the ascites. Wound syringe, ancient syringe, this is a modern syringe. This is an ancient tooth elevator, this is a modern tooth elevator. This ancient tooth elevator was called Sharapankha Mukha Shalaka. This is ancient urethral dilator. First one is Sharari, modern is scissor. Here I would like to tell you that Sharari becomes scissor. You can see the resemblance in the names also. Sharari becomes scissor. These are ancient urethral dilators. These are modern urethral dilators. And while uh, telling you how to use this urethral dilator, Shushruta has given the exact method how you should use it. This is Ardhadhara Shastra, which becomes scalpel in modern science. Now here you can see these are some accessory instruments or Upayantra. Black ants were used, and you can find references in modern surgery that now the head of the black ant is used in modern surgery even to bind the stitches, and it is considered that it has got a biological value because they are not considered as the external thing, and body doesn't react in a negative way. So that this method is also adopted by modern surgery. Shushruta is the first medical person to use leech as a medical instrument, which is being given recognition as a medical device by FDA of USA. And we can see that leech is used in India since approximately 5,000 years. Shushruta has used Agni Karma, that is pottery, which is in practice, regular practice in modern surgery. There is a complete chapter on Shira Veda, that is venipuncture. Now, a surgeon or a student of a surgery was not supposed to do surgery directly on a patient, directly on a human body. He has to do the practice of that surgery. And that was done. See, you can see excision, the practice of excision or chedan was done on certain fruits, on of scraping on the piece of dead skin, a puncturing on the veins of a dead animal. So either they were using some natural objects or they were using dead animals. And this is how the practice of surgery was done. The practice of drainage on the surface of particular plant covered with a coat of beeswax. See, this is how you can see that this is the way, even in modern surgery, a student is supposed to do the practice of surgical, using surgical instruments. And this is what is mentioned in Sushruta Samhita also. "12 types of fractures and 6 types of dislocations are described in Sushruta Samhita. What are the causes, specific features, and even prognosis is well explained. Fracture bed is described. Different types of fixation depending on the site of fracture is recommended. Use of splints is well described. Now, here we can come to know, and this method of treating the fracture is still used in some remote areas in India. And that is how this method of treatment of surgery is derived all the way in all over the India and still in use in some remote villages. These are called marma, or some points in the body, and they are described as the vital points which should be taken care of while doing the surgery. Now, when you think of or when you talk about surgery, you have to obviously think about how patient was made to bear the pain. How can he bear the pain? So, was there any method of anesthesia? I think there was not any medicine, but we find some references that inhalation of fumes of Indian hemp or cannabis was used to desensitize that patient, and even the use of strong wines was used. How the arrest of bleeding was done, I think we have already seen this. Treatment of abscess. You can see that 8 steps of treating an abscess are described. See, if a surgeon is not able to treat an abscess, he cannot be successful. Surgery depends on the success of treatment of abscess, and that is why Sushruta has given lot of importance to treatment of abscess. Bandaging, 17 types of bandaging are mentioned. Definition is given: site, position, types of knots, changing the bandages as per season, which I think is not mentioned in modern science. Bandages to be used from surgery of lips to major surgeries is very well explained. Surgical wards are explained. How should be the surgical wards? Now, here I'm going to show you. This is the wall, and these are the inscripted lines which reveal references of hospital, a physician, a surgeon, assistant, and even a barber. These are the requirements of a hospital, and the timeline of this particular wall is 1063 to 1068 AD, which clearly describes or illustrates or proves. This is a evidence which proves that such hospitals were there in India during that period. What was the pre-operative care which was followed in India and which is explained by Sushruta Samhita? Pre-operative correct diagnosis, disinfection of operation room. You should understand that this was understood by modern surgery 200 approximately 150 years back. All through the years, surgeries were done without taking care of infection, whereas Sushruta has clearly mentioned that operation room should be disinfected by shaping of that part was done to ease the healing process. This is what is also followed in modern days. Nil by mouth, in particular operation, sterilization of instruments by those ancient methods, and surgeon and assistants should wear white linens. Now, if you read all these steps, you will think, you may feel that as if you are reading a modern text of surgery. Post-operative care, application of medicated paste, covering wound by bandages, antiseptum fumigation, consolation of patient, sprinkling cold water on the body, washing wound, suctioning of residue, inserting medicated roll pad, application of medicine again, and praying antiseptic mantra, and special diet for early healing. Now, those points which are underlined are the methods, are the precautions which are taken to avoid the infection. This is the tooth which was found in Mehergarh, and this is approximately 4 to 4,500 years old tooth. What is it doing here? This is the excavation which was done in Mehergarh in old India, ancient India, which is presently in Pakistan. And this news you can read in the magazine, which is famous magazine Nature. Issue is April 2006 issue. Earliest evidence of dentistry in Mehergarh. A total of 9 individuals had one or more cases of teeth drilled in vivo, most probably after therapeutic operation, and that period, according to this news, goes to 7000 BC. These are the evidences which prove that dentistry or surgery in India is going on for approximately 5 to 7,000 years, since 5 to 7,000 years. This is again one reference. There is a full chapter devoted to oral diseases in Sushruta Samhita. Description of 15 diseases of gums are there. Description of 8 dental diseases. Fracture of teeth is mentioned, and surgical instruments to be used in dental diseases. This is clear enough to state that dentistry was well advanced in ancient India. This is how one particular picture is showing you how surgeries were done in ancient India. This I'm going to show you one more evidence, sculptural evidence. This is from Telangana, and period is 1034 CE. Exact date is also mentioned, 4th June 1034 CE, that is AD of this period, this time. And you can find a reference of this research in this particular reference which I have given down below, which mention that Aggalavya, this sculpture is telling you about Aggalavya, who was a great surgeon of that period and who was the expert of Shastra Shastra, that is science of surgery, and who used to do surgery of various diseases. And this wall of this sculpture is particularly formed to give credit to Abdalavya. This is a reference from ResearchGate, and you can find epigraphic evidences of Ayurveda and of Indian heritage. Those who are interested can go through it. Now you can see all together cranial surgery, scrotal surgery, abdominal surgery, bone abscess, suction of fluid from ascites, removal of urinary stone, surgery of fistula nano, intestinal perforation, tonsillectomy, extraction of injured eye, removal of scrotal injury, ophthalmic operations like cataract surgery, methods of obstetric manipulation, extraction of dead fetus from the womb, Udarapatana, that is cesarean when normal delivery is not possible. All these are mentioned in Sushruta Samhita, which definitely demands that Sushruta should be known as a father of surgery. He's demanding his credit. We should know that this surgery, which was going on in India from all the way from 5,000 years, complete description of every surgery is very well explained. And hence, we all demand that Sushruta should be known of the father of the surgery all over the world. Thank you so much.
Thank you so much. It was such an informative, wonderful webinar. Excellent presentation with so many evidences and very, very detailed information. It was absolutely amazing. Absolutely wonderful. Anybody has any questions for Dr. Sawant?
Hello, Dr. Asawari. Nice to see you.
Hello, Dr. Pallavi. So nice to see you.
Dr. Ashwin Sawant, nice to know you are from Sai Ayurveda Mahavidyalaya. Even I'm from the same institute. And I mean, words cannot express how you compiled all such ancient data and presented it. It's worth applauding. I just wanted to know, you mentioned something about keeping the instruments in a leather case or something. So what was the particular reason for doing that? Like,
so that you could keep all the instrument together and safely. Now, this bag can be seen in villages, in barbers who are following that tradition. It is still seen. Even I have seen it, and you can see it on the net also. And that is derived from the Sushruta Samhita. It is mentioned surgical case, which is made from the leather. To keep instruments safely in a proper manner. There were some actually it is in a you should actually see it. I can't explain it.
Oh, we have. I think even I have seen these thick leather cases used.
Yeah, you have to open it, and there are special some what can I say? I don't know.
Compartments.
That is the method they had adopted. I think it is definitely from Sushruta Samhita.
Great. You mentioned something about Harrison also in your talk.
Yeah. Harrison is a text of medicine. What I want to say is this, that when this one particular text of modern medicine, which is going on for approximately, I think, 200 years. Am I right?
Harrison, not that old, I think. Not that old.
What I want to say is this, that one particular text which is going on for some 100 years, say 200 years, compared to that, this text of surgery, Sushruta Samhita, is created, commented, edited, re-edited for approximately 3,000 years. This is I want to stress that this tradition of surgery, tradition of medical science, studying it, editing it, re-editing it, was going on in India for approximately 3,000 years. That is what I want to stress here.
Right. No, but when we see, like in those days, technology was not like how it is in the modern era now. Even in those days, how beautifully and perfectly they used to do the surgeries is really worth, going into more and seeing how they must have
Surprising, unbelievable.
surprised. And even it was known that Acharya Sushruta would steal the bodies when they were buried and bring it to do his anatomical practice.
Right.
Yeah,
Whereas
such a big devotion to the field of surgery.
Surgery. He used to
Mhm.
wait near the cremation ground till somebody comes and puts the body, and then he would bring it and then study anatomy. I think that's what I know.
This was going on in England. In
Acha.
India, I think we don't know because we don't have references or evidences. This is what you say was going on somewhere around 16th to 18th century when people and there were dead body robbers.
Robbers.
Dead body robbers were there. They were very famous in England. I've seen one movie on that also. They used
Acha.
to rob it and they used to give it to scientists or doctors.
Oh,
And
nice.
it was not allowed. But here you can say that it was legally allowed. It seems that it was legally allowed in ancient India because it is mentioned in Shikshra Samhita. The method is mentioned. If you need to have a authority of governing government to do the practice, that means definitely they were getting government's permission to do the human cadaver dissection, isn't it?
True.
Actually, I would like to request you or Dr. Asavari that I'm looking for a better opportunity to deliver this lecture on a better platform, which should be a wide platform because this needs more time. You might have seen that I wanted to complete it. Otherwise, there are some subjects which need to be elaborated properly, and some more evidences should be given. And I want to present it in front of medical community, in front of modern surgeons,
Modern
and on a wide platform, on a bigger platform.
So, Dr. Ashwin, we run a program. I mean, now we have taken a little break. That is TAM, Traditional Ayurvedic Medicine, Therapeutic Uses of Traditional Indian Medicine, which is done by Dr. Harish Verma from Toronto. And I'm also one of the hosts. And there are eminent month or so, I think you can come on that platform. We would definitely
I would like to.
The way you have mentioned right from the time of Atharva Ved and Rig Ved and how you've compiled it, that's really amazing. Collecting all the data, yeah.
Thank you.
Yeah. So definitely, I've taken your number. If something comes up, I will let you know. And then we have a very active Mumbai society, which we recently had a very good program last Sunday at Keshav Shrishti, Bhayandar. So they were all modern medical. The theme was only on modern medicine for Ayurvedic doctors to just update what's going on in different branches of medicine. So that was a very good opportunity actually. So something
I'm
like
looking for it. I'm looking for it.
Dr.
Actually,
Vaidya,
let me tell you, even Dr. Patnankar may accept this, that even Ayurvedic students are not aware of all these things.
Correct.
yes.
Such evidences are available that even Ayurvedic students or teachers may not be aware of this. So they should be made so that whole community of Ayurveda and even modern surgeons should know about it. Once we show them the evidences, then it becomes easy.
Yeah, even Dr. Vaidya Rajan Patankar was there last Sunday, and yeah, Rajan, you're from my batch, right? You're from 19.
Yes, correct.
Anyway, very nice, excellent. Thank you.
Yeah. Thank you again. Thank you so much. And I will definitely keep it in mind, Dr. Ashwin. I will let you know, if I find any really good opportunity for you to present this to the Western doctors or surgeons, because this needs to be, available, and they need to know about all of these facts and so many evidences. Because current life is, it's all about the evidences.
Sorry, Dr. Asavari, but there are some slides on which each slide can be explained in 10 minutes. I need 10 minutes to explain each slide. But
I
then
know.
when time is over, I have to go fast. So if enough time is allotted, and if it's very good platform, I can describe it in a very well manner.
Right.
Absolutely, absolutely. I hear you.
So even we could request Reni Mehra, Dr. Asavari, Dr. Reni Mehra, if she is into taking these interviews, probably she could have an interview with Dr. Ashwin Sawant.
Absolutely. I'm in touch with her. I will definitely reach out to her.
Just put a word across and see, because there, Dr. Ashwin Reni is a person who takes interviews, and she's in the US, and she has a wide audience, like not only to medical but even to the general people. It would be very interesting.
Very good. That is what our aim is. Now, Rajan sir, Dr. Asavari, rather, I think all of us, what we want is appreciation. Appreciation of Ayurveda, appreciation of that surgery was there in India, in Ayurveda. When you talk about it, everybody, a common man, even may it be a modern medical man, they think, "Arey, Ayurveda mein surgery kahan se hai?" This is a common question which is asked by people. Surgery Ayurveda mein kahan se aayi?
True.
Now, even there is one slide. Now, I have removed some slides where I have given one comparison. First, human dissection in India, in modern world. First, medical text. One cataract surgery. First, so that way I have done it. First plaster, and I have found references that when first plaster was done in Germany, when first when first splint was used, when first hospital was formed, and I compared it with Indian tradition. That also some tables are there. Then I have given what were the reasons of downfall of surgery in India. What happened? What went wrong? Those reasons are also explained. That I omitted today.
Right. No, definitely. This presentation needs really long time because there is so much in-depth and so many rich evidence.
हो जातो मी तर तुम्ही बसा तुम्ही जे काही कोण आला पेशंट कारण मी कंपाऊंडर ना आमची आज काय झालं त्यांना काय होतं
Thank you, Dr. Asavari. Thank you so much.
Yep. Thank you so much, everybody, for attending our webinar. And this recording will be available on the CAR YouTube channel. So you can definitely watch it. Please like, comment, and share the videos.
I
And
hope this last discussion will be omitted, no?
Yeah, I need to see like how to do that. Yeah. But this was absolutely amazing. Thank you so much, Dr. Ashwin.
Thank you, all of you. Thank you.
Thank you, Dr. Patankar.
Thank you.
Thank you, Dr. Pallavi.
Thank you. Nice seeing you all. Bye-bye.
Yeah,
Bye-bye. Thank you so much. Thank you.
Yeah.
Thank you, Dr. Asavari.
Thank you so much. Yeah. We'll keep in touch.
Yeah. Thank you. Thank you, Dr. Rajan. Patankar sir, thank you so much. Achha.